go.
Good morning, sir. Our research is about correlation of body mass index and blood pressure of 15 to 55 years of age in Philippines.
Abstract. Aims. There is an intensification in the prevalence rates of overweight and obesity across the globe. Blood pressure, or BP, has been found to increase among population with high body mass index. Overweight and high BP both have independent fatal health consequences as they carry serious risk factors for several non-transmissible diseases such as heart disease, stroke, type 2 diabetes, and even death. It is against this background that this research was carried out to corroborate similar results in Philippines. The objective of this study was to determine the correlation of BMI and BP of adults of 15 to 55 years. Materials and methods. Google Form is used to obtain information on demography and lifestyle. Weight and height were measured using weighing scale for weight and height scale for height. BP was also recorded. They used BP monitor to obtain their blood pressure. Then we gave them a table to determine whether their BP is normal or high. Results. The prevalence of overweight and obesity was found to be 15% and 3% respectively. About 3% of the participants were hypertensive. Conclusion. An increase in BP positively influenced BP among the study adults population.
Introduction. Obesity, described as abnormal or excessive fat accumulation, has been steadily growing in prevalence since the 1970s and has more than tripled over a 40 years period. Relative to many high-income countries, the increase in obesity rates appears to be faster in Asia. As of 2014, about 5.1% of the Filipino population was classified as obese, representing a 24% relative increase in the number of obese Filipino adults from 2010. This increasing trend in obesity is concerning because it imposes an additional burden on top of the already existing problem of undernutrition and infect, infectious disease typical in low and middle income countries. In 2016, Philippines healthcare spending on obesity alone has already about amounted to somewhere between 500 million US dollar and 1 billion US dollar. Body mass index is a measure of the human body weight and in relation to the height, calculated by dividing the weight and a person in kilogram by the square of the height in the meters. The WHO classified BMI as low as normal, overweight, and obese. BP is the pressure of the resistance of blood flow against the wall of arteries. Systolic blood pressure is the top number refers to the amount of pressure in your arteries during the contraction of your heart muscle. Diastolic pressure, however, it is the pressure required to allow constant flow in the body, vessels, and filling on the ventricles before the next systole. According to Saxon et al., high BP is defined as the systolic reading of greater than or equal to 140 mmHg and or higher over an diastolic reading of greater than or equal to 90 mmHg. Studies have shown that BMI and BP are both the increase of worldwide and epidemiological. Studies, study shows positive correlation between the two. Some factors seems to play the significant role, such as consuming too much calories coupled with not physical exercise enough to burn out the excess calories. A combination that easily results the become overweight.
So, this is the table about background characteristics of respondents. And this is the table about lifestyle variables, table about blood pressure profile of respondents. Table 4 is all about correlation between body mass index and blood pressure of respondents. Materials and methods. Google Form is used to obtain information on demography and lifestyle. Weight and height were measured using weighing scale for weight and height scale for height. BP was also recorded. They used BP monitors to obtain their blood pressure. Then we gave them a table to determine whether their BP is normal or high. Data analysis. The data were analyzed using Google Form. Correlation analysis was used to determine the strength of the association between BMI and BP. BMI classification was 30 kg per meter square equals obesity. BP was classified as high or normal according to the classification of SBP, which is high greater than equal 140 mmHg and normal.
Results and analysis. Table 1 describes the background characteristics of the respondents. There are significant differences in the occupations engaged in by the participants and levels of education of both sexes. Table 2 shows the lifestyle variables of the study participants. Only 75 of the participants engage in any exercise. 5 of the participants smoke cigarettes and 50 drank alcoholic beverages. Table 3 shows the blood pressure profile of the respondents. Most, Mostly more are normal as the table shows few only as high. Figure 1 shows the percentage distribution of BMI classifications of the respondents. Majority of the people no, were of normal BMI for about 75%. About 15% were overweight while 3% were obese. Figure 2 shows the percentage distribution of BMI classification of respondents according to sex. Majority of the females were of a normal BMI, about 39%. Males were overweight and obese more than females. Among 3% of the sample population that were obese, 2% were males while the remaining 1% were females. Figure 3 indicates the percentage distribution of BMI classification according to levels of exercise. A low exercise level was observed in this study population. All the underweight and obese respondents did not engage in any exercise. Only 70% of the respondents had normal BMI and also exercised. The overweight respondents of who exercised were only 5%. Figure 4 shows the percentage distribution of BMI classification based on age group. BMI was observed to increase with an increase in age. The highest percentage of respondents of a normal BMI across the age groups was 70, which was recorded by the 15 to 25 years group. Within 25 to 35 years group had only had only obese and overweight. Furthermore, 35 to 45 years group had a normal, obese, and overweight, but we don't get any participants at 45 to 55 years group. Table 4 shows the correlation between BMI and BP of respondents. More of, more of the overweight respondents had high SBP than the overweight individuals with normal SBP. An association was observed between BMI and BP. However, the R value shows a weak negative correlation. which is negative 0.1580 39741. Discussion. BMI as a measure of body weight was classified according to the WHO as underweight, normal, overweight, and obese. Overweight and obesity are risk factors for many diseases, including high BP. Hence, the prevalence of overweight and obesity is of a great importance to this study. 25 participants, 7% were underweight, 15% were overweight, and 3% were obese. Males had a higher prevalence of overweight and obesity than females. Among, among the females, 3 were overweight while 1 was obese. The prevalence of overweight and obesity in males was 12 and 2 respectively. This observation is in line with results from literature. This could be due to the fact that men are physically active than women. Only 30 women engage in exercise, whereas 45 men engage in exercise. It was also found that men work longer hours than women. Even, even among workers in white-collar jobs, working can help to reduce the risk of obesity because working increases energy expenditure since the brain utilizes the energy from food leaving meal or none to be stored as fat. This implies that females are at risk of diseases associated with overweight and obesity, such as type 2 diabetes mellitus, heart diseases, and stroke than males. Age is a factor that affects the BMI of individuals. Across the age groups, the highest rate of obesity was recorded by the 15 to 25 age group. The, the increased incidence of hypertension in males than females could be due to differences in lifestyle. For instance, more men smoke cigarettes than women. In this study, there was a significant difference between males and females on smoking. No, no female smoked cigarette, but 5 of the male participants smoked cigarette.
So this is the figure 1. It is all about percentage distribution of body mass index classification of respondents. Figure 2 is all about percentage distribution of respondents of body mass index classification according to sex.
However, a negative correlation was obtained between BMI and SBP. R is equals to 0.15803971. This is a weak correlation. According to the result from literature, this is unexpected. However, it could be due to the fewer number of participants who were obese as compared to the one with normal BMI. Furthermore, BP was a lot of confounders which could lead to this unexpected outcome. BMI is not the best indicator of body fat. A high BMI does not necessarily mean that there is an increased body fat. A high BMI can be as a result of increased bone density or muscles. These days, most people prefer taking cars to walking. Furthermore, we do not engage in regular exercise. From the result obtained in this study, it is very evident that overweight and obesity occur as the result of less physical activity. All the obese participants do not engage in any form of exercise. Furthermore, the overweight individuals who do not engage in any exercise were 25. Exercise is a very important factor to consider in decreasing the incidence of overweight and obesity in populations. This is because exercise helps the body to burn fat and utilize excess calories.
Figure 3. This is all about percentage distribution of body mass index of respondents according to level of exercise. Figure 4 is all about the percentage distribution of body mass index of respondents based on age group. Consumption of energy in excess is one of the factors that lead to increased BMI, especially when it is coupled with less physical activity. From the result obtained in this study, it was observed that majority of the participants consume excess energy. However, there was no significant difference between the fat consumption of males and females. More males consume energy in excess as compared to the females. For instance, 25 males consume excess energy as opposed to the 30 females who consume excess energy. Aging is one of the factors that influence the incidence of high BP. The occurrence of elevated SBP increased across the lifestyle of the participants. The highest prevalence of high BP was observed in the age group 25 to 35. The number of hypertensive participants who were 25 to 35 years was 3. Conclusion: the prevalence of overweight and obesity was found to be 15% and 3%, respectively, in Philippines. The obese participants are both male and female, which is 2% male and 1% female. The prevalence of high BP was recorded as 3%. An association was found between high and normal SBP. However, the correlation analysis showed a negative correlation between BMI and BP, which is negative 0.1580 39741. Exercise was observed to affect BMI. All the 3% obese people did not engage in any exercise. BMI also increased with an increase in age. That's all. Thank you.